Hansen's disease, also known as leprosy, by Sean. Hansen's disease is a condition caused by two functionally identical bacteria, Mycobacterium leprae and Lepromatosis. They are both gram-positive rods, which can either appear straight or as curved "ghosts" when stained, and they are obligate aerobes and intracellular parasites. Due to the requirements of a lower amount of oxygen than normal, and a newfound lack of ability to grow outside of a host, they can't be cultured normally. In addition to this, they are mostly immobile and don't form spores, and their replication cycle takes around 12 to 14 days, a practically glacial pace compared to E. coli's 20 minutes, or even their sibling M. tuberculosis at 20 hours. They grow best at a lower temperature than the body's core, preferring somewhere in the range of 27 to 30 degrees Celsius, so it typically resides in mucous membranes or nerves of the skin. M. leprae and Lepromatosis have a few things to assist in their invasion, the most prominent of which is their mycolic acid found in their cell wall, which helps resist the effects of many antibiotics. Though they can't grow outside host cells anymore, unlike TB, their intracellular nature helps avoid detection by the immune system, and the protein fibronectin helps them start that process by infiltrating Schwann cells, which wrap peripheral nerves. Looking at the picture displayed, the disease is typically found in the lower hemisphere, most prominently in India, Brazil, and some parts of Africa, so it is uncommon to see in the United States outside of travelers who just returned from those locations. To promote awareness of the disease's effects, modern treatment, and the stigma surrounding infected patients, the last Sunday of each January is World Leprosy Day, so now you too know how to celebrate the progress towards this 4,000-year-old disease's eradication. Leprosy spreads through droplets in the air when prolonged contact is had with an infected patient. Usually, the patient is human, but some armadillos and other small animals are carriers, as can be seen in the image on the top right. About 95% of all people have some degree of natural immunity to this disease, but for the unlucky 5%, symptoms affecting the skin, nerves, nose, and eyes could manifest. If left untreated, the symptoms may progress to blindness, nerve pain, reabsorption of the bones of fingers and toes, and disfigurement, as seen in this cartoon here. Diagnosis is typically done by examining any skin lesions or discolorations that form, with treatment being started early to prevent long-term damage. Once treatment starts, patients are no longer contagious, and it consists of an antibiotic cocktail, with the first two drugs listed taken daily, and the last one taken at less regular intervals for about a year or two. As for prevention, because tuberculosis is in the same bacterial family as leprosy, the TB vaccine given as part of the regular schedule indirectly mitigates the effects of leprosy. As with its growth, incubation also takes a very long amount of time, ranging from just under a year to a full 3 decades, making its home in the eyes, nose, skin, and nerves. There are two major types of infections regarding leprosy, tuberculoid and lepromatous. The former is characterized by a strong natural immunity, but not strong enough to negate the infection entirely, and its defining trait is loss of sensation of patches of skin where leprosy has colonized. On the other hand, the latter is how leprosy is typically thought of, marked by lumps on the skin, paralysis, and disfigurement, especially of the fingers and toes, as bone is absorbed back into the body over time. The image depicts a newly infected cell, which may also prompt others to undergo apoptosis, breaking the skin apart and causing injuries. And these are my sources. Also, shout out to the game Darkest Dungeon and its sequel, because both of those games have a character with leprosy, which is what made me decide to choose this disease.